Our top story, the Prime Minister chaired a review meeting yesterday evening on availability and supply of oxygen and medicines to battle the COVID pandemic. During the meeting, it was discussed that the supply of oxygen is now more than 3 times the supply during the peak of the first wave, is what the Prime Minister's office said. Well, let's go across to NDTV Sunil Prabhu now for more. And Sunil, the Prime Minister also spoke about the ventilators that have been sent to all the states.
That's right. He's asking them to operationalize them, work with the manufacturers. Because as you rightly pointed out, not only has the oxygen supply increased to the optimum level, and they're pretty happy with the fact that after the export of oxygen, the various steps that have been taken to ensure that on a time-bound manner, the oxygen has been reached. Now also on the issue of ventilators, where there have been complaints from states, to ensure that they're operational and work with the manufacturers so that they're effective and people who are gasping for breath are able to get those much required ventilators and work in working condition.
And Sunil, more details of what was discussed in terms of medicine and preparedness, given the sort of crisis, and vaccines as well. Did that also figure in the meeting?
Sadly, no, not vaccines. I mean, of course, definitely life-saving drugs was discussed, and as well as how they're working with manufacturers to ensure that the drug production and all required life-saving drugs are meeting that requirement, and there is no shortage which...
All right, so Sunil telling us about the meeting the Prime Minister held yesterday, where he reviewed medicines and oxygen, and also asked that ventilators that have been sent to all the states, that the states ensure that they're in working condition. This is after reports from several parts of the country of ventilators not being used or not working. In fact, a number of ventilators purchased under the PM CARES Fund are lying unused at multiple hospitals across the country, either because they're allegedly defective or there's a lack of skilled manpower to operate them. Why is life-saving medical equipment desperately needed amid the skyrocketing COVID cases not being used, and where does the buck stop? Here's a report from UP and Punjab.
In district hospitals in Uttar Pradesh, ventilators procured under the PM CARES Fund gathering dust at a time when they are needed most in the midst of the pandemic. The ventilators, unused, locked up in stores, tell a story of almost criminal negligence. In the Firozabad Medical College, 75 ventilators unused for over a year. 119 were purchased under the PM CARES Fund. Of these, only 39 have been used. After reports in the media, a sudden flurry of activity.
शासन के दिशा निर्देशों में 50 वेंटिलेटर तो कैंसर हॉस्पिटल लखनऊ भेजे गए हैं, 15 वेंटिलेटर प्रयागराज मतलब इलाहाबाद मेडिकल में गए हैं, और 10 जो हैं कल कमिश्नर साहब के आदेश पे मिलिट्री हॉस्पिटल आगरा को गए.
It's not just Firozabad. In Balia, when Minister Upendra Tiwari went on an inspection, people complained about COVID deaths due to lack of oxygen. Ironically, in Balia, there is no trained staff to operate the 29 ventilators sent there.
18 वेंटिलेटर बसंतपुर में पड़े हुए हैं, 11 वेंटिलेटर जिला अस्पताल में पिछली समाजवादी पार्टी की सरकार के ही पड़े हुए हैं, जो उस समय भी ट्रायल होकर के हैंड ओवर लोगों ने नहीं लिया. और इस आधार पर जो कल मैंने मीटिंग लिया, उसमें 18 वेंटिलेटर खराब स्थिति में पड़े हुए थे. जिला प्रशासन और कमिश्नर ने और प्रमुख सचिव तक मेरी बात हुई.
Kaushambi too received 24 ventilators. Of these, 15 were sent to a private hospital. 9 are lying unused, as there are no skilled technicians to operate them.
संज्ञान में आया है, उसके लिए जल्दी से जल्दी जो व्यवस्था हो सकती कराएं.
In Lakhimpur Kheri at the COVID hospital, another similar story of neglect. Of the 25 ventilators, 18 are defective. And in Aligarh at the Deen Dayal hospital, where they received 60 ventilators, 50 are allegedly not working. And former minister from the BJP government, Dalveer Singh, has written to the Chief Minister about it. In Punjab too, at the Guru Gobind Singh Medical College and Hospital in Faridkot, a similar story.
हमारे पास इस समय टोटल वेंटिलेटर जो ठीक हैं वो है अराउंड 42 वेंटिलेटर्स, ठीक है जी, और कुल हमें 82 वेंटिलेटर प्राइम मिनिस्टर योजना से आए थे. प्राइम मिनिस्टर योजना वाले जो हैं उसमें से लगभग 62 वेंटिलेटर्स वो खराब हैं और वो शुरू से ही खराब हैं.
This is now the subject of a letter war between the state government and the centre. The centre says they had written to Punjab in April this year asking them to begin using the 809 ventilators sent to them last year. The state government in turn says that they had replied to the centre in May this year saying that the ventilators were faulty. The opposition in Punjab has asked the state government to fix the issue at the earliest.
6 ਦਰਜਨ ਦੇ ਕਰੀਬ ਵੈਂਟੀਲੇਟਰ ਜਿਹੜੇ ਪੀਐਮ ਕੇਅਰ ਦੇ ਵਿੱਚੋਂ ਆਏ ਸੀ ਉਹ ਅਨਯੂਜ਼ਡ ਪਏ ਆ ਮੈਡੀਕਲ ਕਾਲਜ ਫਰੀਦਕੋਟ ਔਰ ਪੰਜਾਬ ਗਵਰਨਮੈਂਟ ਦੀ ਇੰਨੀ ਨਾ ਅਹਿਲੀਅਤ ਹੈ ਕਿ ਉਹਨਾਂ ਨੂੰ ਠੀਕ ਨਹੀਂ ਕਰਾ ਸਕੇ ਹਜੇ ਤੱਕ ਉਹ ਠੀਕ ਕਰਾਓ ਕੈਪਟਨ ਅਮਰਿੰਦਰ ਸਿੰਘ ਜੀ ਇਹ ਘਰੇ ਬੈਠ ਕੇ ਕੁਝ ਨਹੀਂ ਹੋਣਾ.
Complaints by Punjab and UP come close on the heels of similar complaints by Madhya Pradesh and Chhattisgarh, where 2 ventilators purchased under the PM Cares Fund are lying unused. With Kamal Khan in Lucknow and Mohammad Ghazali in Chandigarh, Rohit Wellington for NDTV.
And in UP, fresh reports have emerged of multiple bodies found buried in sand at 2 locations by the Ganga in Unused district, just 40 kilometers from state capital Lucknow. Visuals from both locations showed many buried bodies with locals looking on. Most of the bodies were wrapped in a saffron cloth. It's not clear if these bodies are of COVID victims. Locals believe the shortage of wood for funeral pyres might be one of the reasons why corpses are being abandoned in this manner.
बक्सर घाट एक ऐसी जगह है जहां 3 जिलों का बॉर्डर है, फतेहपुर, रायबरेली और उन्नाव. वहां 3 जनपदों के लोगों की मृत्यु होने पर वहां लोग शव जलाने आते हैं. कुछ लोग ऐसे हैं जो शव को गंगा किनारे रेत के नीचे दबा भी देते हैं. तो ये जानकारी मिलने पर मैंने तुरंत अपने एसडीएम को और पुलिस क्षेत्र अधिकारी को भेजा है और अभी तक उन लोगों ने जितना देखा है किनारे की तरफ तो इस तरह की खुले में बॉडी नहीं आई है, लेकिन अन्य जगह भी मैंने जांच करने के लिए कहा है और जो भी स्थिति आएगी इसमें उचित कार्रवाई की जाएगी.
Now 10 more bodies have been recovered from the Ganga, a tributary in fact of the Ganga, this time in a super net which was thrown at the UP-Bihar border. The Bihar government has urged the centre to hold an inquiry to find out who is throwing dead bodies in the Ganga. In the meantime, the Patna High Court has also stepped in and asked for a report by Thursday. Manish Kumar with this ground report from Buxar.
After this super net was thrown by Buxar district administration at Karnataka river, a tributary of the Ganges on Bihar-UP border, 10 more bodies were recovered today. With this, the total bodies fished out from this river has crossed 80, as at least 71 decomposed bodies were retrieved on Tuesday. Eyewitnesses claim bodies were being thrown at the behest of local police post on the UP side.
कौन आदेश दिया था लाश को अंदर ले जाने के लिए?
यहाँ सब चौकी वाला साहब है, चौकी वाला बोला, 12 चौकी वाला बोला.
Meanwhile, the Buxar district administration today heaved a sigh of relief when at this Mahadev Ghat, not a single body was found floating today. Going on an offensive, Bihar Water Resources Minister Sanjay Jha urged centre for a probe. Jha, in a series of tweets to Union Minister for Jal Shakti Gajendra Singh Shekhawat, said that this is an insult to the river Ganges. With Patna High Court now taking note of these floating dead bodies, it seems that at last there will be some dignity in death to all those who are succumbing to COVID. With Manish Kumar, Usama Shab for NDTV.
Now, UP has reported over 20,000 daily COVID cases for the last week and 250 plus deaths each day. And these are just the official figures. Across the state, there's a worry over the spread of the pandemic to the state's vast rural areas where a lot of COVID deaths may go unreported. The state government says it's now launched a massive tracking and testing drive across rural UP. But can the rural surge in India's most populous state be contained?
Fewer chaotic scenes at the main COVID crematorium in Lucknow. A month ago, these disquieting scenes of endless funeral fires were filmed at the same location. Ironically, the UP government was reporting lesser COVID deaths in Lucknow at the time, despite evidence from crematoriums suggesting massive underreporting. On Tuesday, Lucknow reported 1,154 fresh COVID cases and 23 deaths. 241 people have died in Lucknow from COVID in the past week. A month ago, on April 14, UP's capital reported 5,433 fresh COVID cases, but just 14 official COVID deaths. Lucknow has seen over 2,000 COVID deaths since the beginning of the pandemic, the highest for one location in UP. While no official count of Lucknow's cremations, COVID or otherwise, for the last few days was available, but quieter crematoriums certainly do indicate that the data being given out by the UP government now is a little more in sync with ground realities. But are more deaths now happening in UP's sprawling rural areas? And are these deaths being underreported? At Kheda, a village in West UP's Meerut district that reported 1,368 fresh COVID cases on Tuesday, the highest in UP, locals claim at least 30 people have died from COVID-related symptoms in the last 10 days. On Tuesday, this UP government team was in Kheda to carry out gold standard RT-PCR and antigen tests as part of the UP government's drive to track and treat COVID in rural areas. 10 days ago, a relative of this Kheda resident, Praveen Som, saw her oxygen levels dip to 60 after days of persistent fever, despite a negative RT-PCR test report. Despite a scramble for a hospital bed, she could not be saved.
ना तो कोई संघ वाला काम आया ना कोई भाजपा वाला काम आया, सबने हाथ खड़े कर दिए। मैंने जने किस को फोन करे, जब मेरी भाभी को वेंटिलेटर की जरूरत थी, किसी भी आदमी ने मेरा फोन उठाना बंद कर दिया। वो अपने व्यक्ति का संबंध बनाओ साहब, ना कोई संघ वाला खाने को दे रहा, ना कोई भाजपा वाला संघ।
In Sardhana, a small town in Meerut, government officials claim they have tracked over 58,000 people for COVID screening and identified 1,036 people with symptoms in the last few days. But at the government-run hospital in this town, there are barely any treatment facilities for COVID patients.
जितनी भी डेथ हो रही है उसमें कोविड 90% केसेस नहीं है। एक नया टर्म निकल के आया है, हैप्पी हाइपोक्सिया। मरीज बिल्कुल ठीक होता है, उसको कोई किसी तरह का सिम्टम नहीं होता, खासकर जवानों में। उनका एकदम से ऑक्सीजन लेवल डाउन होता है, पहले 85, जब तक हॉस्पिटल लेके जाते हैं 60 के नीचे आ जाता है फीवर के साथ साथ, और वो तुरंत कोलैप्स कर रहा है।
The Uttar Pradesh government says it is tracking the spread of COVID in rural areas in a big manner. But are these efforts enough? With Ravish Shukla in Meerut, this is Alok Pandey, NDTV.
And in villages in Haryana, COVID is spreading fast, and with testing not as widespread as it should be, locals say that many are dying of fever where testing is possible. COVID is seen to be the cause behind the deaths, but with so many people dying before they can even be tested, the worry is that these deaths are not being recorded in official figures. Saurabh Shukla filed this report from Titotli village in Rohtak.
Dharmender's two brothers died within a week. Both were in their 30s. They had similar symptoms, fever to begin with and then difficulty in breathing. By the time they could get a place in a hospital and oxygen, it was too late.
सरकार कह रही है कि इनको प्राइवेट को मत दो, हॉस्पिटल वालों को दो, और हमारे पाबंदी लगा दी। फिर लास्ट में बहुत दिक्कत होगी और एडमिट करवाए तो इतने में चेस्ट चारों तरफ से घेर लिया था बीमारी ने, और 4-5 दिन के बाद हमारे दोनों भाइयों की डेथ हो गई थी। टाइम पे एडमिट होते तो बच जाते थे।
In Rohtak's Titoli village, mourning and lamentation. In the past 10 days, there have been 18 deaths here due to COVID. But the village sarpanch says the figures could be higher. 40 people died in the past fortnight due to fever. Most of them did not get tested for COVID.
हम ये मान रहे 90% कोरोना से मर रहे हैं। अच्छा। हाँ, यही लक्षण है। और जो गांव में थे जो टेस्ट नहीं करा पाए, जो गरीब आदमी है दाखिल भी नहीं हो पाए कहीं, वो कोरोना के पेशेंट थे।
The Haryana government is worried about the rampant spread of COVID in rural areas. Special teams have now been formed.
अभी तक शहरों में ही ये ज्यादा फैला हुआ था कोविड। कोरोना के फैलाव का अब पिछले 3 दिन से इंडिकेशंस आ रहे हैं कि गांव में भी तेज गति से बढ़ने लगा है। उसमें जो कोविड के पेशेंट संभावित होंगे, चाहे वो मॉडरेट हैं और चाहे वो सीवियर हैं, ऐसे जो पेशेंट्स को वहां से ला करके हम अस्पतालों में दाखिल कराएंगे।
In Rajasthan too, of the total number of COVID cases, 41% are from rural areas. In an unusual case in Sikar's Khirwa village, 20 people died between the middle of April and the first week of May. None of these have been confirmed as COVID deaths.
हर तरह से डोर टू डोर सर्वे करवाया, जो कि हम बाकी जगह भी करवा रहे हैं, लेकिन वहाँ पे हमने विशेष ध्यान देके करवाया है। और साथ ही साथ हमने ज़्यादा से जितने भी पेशेंट्स इसमें ऐसे पाए गए हैं जो कि उसके संक्रमित व्यक्ति के संपर्क में हैं या फिर जिनको किसी प्रकार के लक्षण हैं, उनको दवाइयों की किट उपलब्ध कराई है घर पर ही। ये काम पूरे जिले में किया जा रहा है, लेकिन कुछ पंचायतें जहाँ पे ज़्यादा केसेस अचानक से आ गए थे, उनमें हमने विशेष ध्यान देके बहुत बड़े स्तर पे करवाया है।
The administration did over 150 RT-PCR tests in the village. Though only 6 people were found positive, the village has been declared a no-mobility zone. With Saurabh Shukla in Rohtak, Harsha Kumari Singh, NDTV.
Now, COVID cases in Karnataka and Bengaluru have been coming down over the last few days, but still remain very high, with Karnataka the worst hit state and Bengaluru the city with most number of active cases. Karnataka is trying some new approaches to ease the trauma of patients looking for precious hospital beds. Maya Sharma reports.
Getting a hospital bed for COVID treatment has often been a nightmare for patients and their families in Bengaluru, the city with the most number of active cases in the country. Now the city authorities are trying new approaches, starting with tri-age centres in each of the sprawling city's 28 assembly constituencies. Patients can just head there. No need to go through the helpline or wait for an ambulance. Doctors there will decide whether they need home care, should go to a COVID care centre or should be hospitalised.
Who require hospitalization are triaged and sent to the hospitals. Who require admissions in this direction. We are trying to streamline so that the demand and supply is addressed very effectively. There should be zero problem. It is only 28 places, 28 locations have been given. In any of this location, anybody can go from anywhere and get triaged.
Oxygen has been a struggle, even for those admitted to hospital, with many city hospitals having run short of supply. Another new approach is the use of oxybuses, which will be able to provide oxygen to 8 patients at a time outside a tri-age centre or hospital. And in association with Ola and NGOs, the state has also seen the launch of a free service of home delivery of oxygen concentrators. Vaccine supply remains a huge challenge, and the state has put out a global tender for 2 crore vaccines, in addition to 3 crore doses already ordered from Indian manufacturers.
See, already we have placed order for 3 crore vaccine with Serum Institute as well as Covaxin. So they are going to supply the vaccine. Along with that, additionally, we are trying to procure from various sources. Whoever can cater our requirement, immediately we are looking to them. So that there is a lot of demand. There's a lot of demand for the vaccine. People want to get vaccinated as early as possible.
This is one of the hospitals that will be used as a tri-age centre in Bengaluru. Patients should not be denied access to such centres. The hope is that new initiatives like this and an enhanced supply of oxygen and vaccine will help Karnataka and Bengaluru turn the corner. With DM Kumar, Maya Sharma in Bengaluru for NDTV.
And just 2 days after opening the vaccination for the 18 to 44 age group at select sites in Bengaluru and Karnataka, the state government has now announced that vaccination for this age group, including those who've already booked appointments, will be temporarily suspended from the 14th till further orders. It was decided by the government to utilize complete supply of vaccines provided by the Government of India for vaccination of people above 45 years of age and vaccinating beneficiaries who were due for a second dose. Time for us to slip into a short break. Coming up on the other side, in Bengal, the Governor and Chief Minister lock horns once again. Welcome back. The West Bengal Chief Minister Mamata Banerjee and Governor Jagdeep Dhankar have locked horns once again, and this time over his plans to visit Cooch Behar district to meet, as he puts in several tweets, people affected by post-poll violence. According to his tweets, Mr. Dhankar is to visit the Cooch Behar district today. On Friday, he plans to visit camps in Assam where alleged victims of violence in Bengal have fled for shelter. In the letter to the governor yesterday, Ms. Banerjee requested him not to break the well-established norms and go off on a unilateral visit across the state. Within an hour or so of her letter becoming public, the governor responded with his own letter in which he wrote of elementary ignorance of constitutional provisions and that he was not persuaded by her stance for which there would be no saint takers. The letter does not categorically spell out whether the governor will continue with his visit or not. As per his plans, he is supposed to land in Cooch Behar at 11 a.m.
After the government has been formed, there was only 2-3 days. The central team has come and they have visited several places along with the leaders of a particular party to look into the law and order affairs. On the contrary, when the entire country is dying, our central government is having no time to send any genuine impartial health team. On the contrary, just see, our government, our honorable governor is busy. He will be busy in visiting Sitalkuchi. He should have been much more concerned in visiting the health structure, in extending best possible cooperation, in negotiating with central government on behalf of his own state government, where he is the governor. But he doesn't find any time to do that. As he is being guided by Bharatiya Janata Party All India leaders, he is more busy in looking after law and order, Sitalkuchi, XYZ. He is hardly concerned about the health structure of his own state. That is the most unfortunate part of the day.
With that, time for us to slip into a short break. On the other side, we focus on the COVID crisis in Goa, where there are also reports of oxygen shortage. Goa is staring at a massive COVID crisis with high positivity rate being reported in the state. After 26 patients died at a Goa hospital, the Goa bench of the Bombay High Court pulled up hospital authorities saying no one should die due to oxygen shortage.
A crisis in the making, an overcrowded hospital in Goa where patients are lying on the floor because there aren't enough beds, and a positivity rate that touched 50% just a couple of days ago, meaning every other person that is tested in Goa is COVID positive. After Goa's Health Minister Vishwajit Rane announced that as many as 26 patients died in Goa Medical College in the early hours of Tuesday because of a lack of oxygen, the Goa bench of Bombay High Court on Wednesday pulled up the dean of the hospital saying, enough is enough. Sometimes the authorities say there is enough oxygen, but there are logistical constraints. Sometimes they say there is not enough oxygen available for additional cylinders. Goa Chief Minister Pramod Sawant, wearing a PPE suit, visited the hospital to take stock, where he spoke with doctors, healthcare staff and even interacted with patients, admitted that there are difficulties, but there is no shortage of oxygen.
जितने कोविड वार्ड है वहाँ जाके मैंने डॉक्टर से बात की, नर्सिस से बात की, वहाँ के हाउसकीपिंग से बात की, पेशेंट से बात की. वहाँ के डिफिकल्टीज हैं, वहाँ पे सिलेंडर पहुँचने के लिए थोड़ी बहुत देर होती है, दैट इज देयर, बट हमारे पास सिलेंडर्स अवेलेबल है, ऑक्सीजन अवेलेबल है.
Goa, the state with a population of merely 2 million, has a positivity rate of 41%. This after recording a massive 51% just last week, the numbers giving a sorry picture. As of the 12th of May, the state recorded a little over 2,865 cases from a testing sample of 6,920. The deaths recorded were 70, a little lower from the 75 recorded on the 11th of May. The recovery rate is 72%.
The infectivity rate is coming down. It was around almost touched 51% at a time. And last 2-3 days from 41%, then it has come to 35% yesterday.
After much criticism, a delayed response from the government, Goa is under 15 days of curfew. With this, the administration is hoping that the situation will improve in the coming days. With Anil Patil in Goa and Purva Chitnis, Anusya Mathur for NDTV.
Well, to talk more about the situation in Goa, we're joined by Pramod Acharya, Editor-in-Chief, Prudent Media in Goa. Pramod, thank you so much for joining us. What has the situation been overnight? And there seems to be this sort of blame game. The Chief Minister claiming that there is enough oxygen supplies, though clearly 26 people died because, as many relatives have alleged, there was a shortage of oxygen.
Yeah, absolutely. The side of Goa government and the actual situation on ground got completely exposed in the High Court yesterday. So what we are gathering, overnight situation, there was a huge oxygen drop last night in Goa Medical College. Sources inside Goa Medical College tell us that there have been deaths. There is no exact number of deaths that we are gathering at this point of time, but all the sources inside Goa Medical College are confirming that there have been deaths overnight. There was a drop in oxygen because High Court pulled up the government. They arranged a lot of oxygen cylinders last night, but the central line of Goa Medical College experienced a huge drop between 2 a.m. and 6 a.m. So if you ask me, because the High Court pulled up the officers, because the High Court pulled up the government, they somehow managed to get the oxygen cylinders. But as far as the central line, oxygen line is concerned, the situation still continues. And whether the supply of cylinders that they arranged last night, whether it will continue in the coming days or no, or is it only because of the High Court hearing, that needs to be seen. And yes, there is a political one-upmanship game that is going on between Health Minister and the Chief Minister, and that is also affecting this entire situation.
Right, Pramod, so you're telling us again there have been reports of deaths taking place overnight due to oxygen shortage. This despite more oxygen cylinders being organized. We're also joined by Dr. Shekhar Salkar, consultant oncologist at Panaji Goa Manipal Hospitals. Doctor, have you heard something similar? Can you give us more details about what happened overnight?
See, normally if you see in COVID patients, normally at 2 o'clock to 4 o'clock is a dicey period anyway. And at that time, if there is a little drop in oxygen pressure, it's always a problem. Because that time is the most sleepiest part of this. All the MTS or everybody is in a sleeping condition. The oxygen cylinder may not be functioning properly, then nobody is there to literally, help those people. And normally what happens in the COVID patients, at that time in the morning, 2 o'clock or so, because they are in a deep sleep, they breathe very low, their oxygen level is the least. And when they get up, sometimes they remove their oxygen and want to go for a passing motion or a urine. And that's the time they suffer from a suddenly low, and they collapse. Yes, oxygen is a problem, is not the availability of the oxygen, but I think the logistics are the problem, is to ship. Because Goa Medical College is a 1,200 bedded hospital, doesn't have a central plant like liquid medical oxygen. They depend on the trolleys. And to change the trolleys, bring the trolleys, there is a big, this is going, the logistics are involved in that. So the drivers have to go collect, fill the cylinders, come back, and again attach those trolleys to the main pipe. So I think what is the important part is that important patients who are in a critical patient should be shifted to the 500 bedded hospital, because that is the one which has got a central supply and has got a liquid medical oxygen, which it can be maintained properly the pressure.
Right, so you're telling us about the logistical issues as well. But
staffs are very important because there is a lack of staff. You may give a lot of facilities, but to get a trained staff is a real problem. And Goa
so a problem of manpower as well.
Facility.
So, Dr. Salkar, as you're telling us, there's a lot of logistical issues, but given the scrutiny of the High Court and the High Court giving such, stern statements saying this would be a violation of the right to life, saying that, it's the state's duty to protect the life which will be violated if anyone were to die of oxygen shortage. So, even despite the scrutiny of the High Court, again, we're told deaths have taken place because of perhaps manpower shortage, and the government time and again claiming there's no oxygen shortage.
See, oxygen shortage is there everywhere, all over India. If you see in all the states, yes, oxygen problems are there. Comparatively, actually, we are in a much better state because our private sector also is now admitting a lot of patients. So the burden on the government sector has gone down. But yes, I believe that we should have the liquid medical oxygen and a continuous supply, which is a smooth supply with proper pressure, has to be there. But in a cylinder type of functioning, it is not possible to do all these things. Plus, you require a lot of manpower. Suppose the oxygen cylinder become half, the pressure automatically comes down, and you need to change this cylinder.
Right.
But you require expertise to change the spanner and other things are required.
All right, so
it's
shortage of
important to realize
manpower
that
as
lot
well.
of manpower which is required, which is not possible.
No,
And
Gaji,
at a given time, too many patients
Right, Dr.
coming
Salkar,
is
I'll
a major
just get
problem.
Pramod Acharya in again. Pramod, so, I mean, given the scrutiny of the High Court, it's just absolutely shocking that, you know, they didn't throw everything at this crisis and have more hands on deck, as it were, to ensure that they don't go through this again. And you're telling us we're still waiting for that confirmation that more deaths have taken place overnight.
So multiple sources are confirming that more deaths have taken place overnight. And as Dr. Salkar mentioned, if it is a logistical issue, we are witnessing this logistical issue for last at least 8 to 10 days. And if somebody is telling me that the health ministry or the chief minister's office are unable to sort out logistical issues and save lives, now that's very, very distressing. That's very distressing for the people of Goa. That's very distressing for the relatives of the patients who are losing their loved ones. That 8 to 10 days we are unable to sort out logistical issues. And the line that the government is consistently taking is there is no problem with the availability of the oxygen. It is only the logistical and the supply lines issue. And if that is the case, how distressing it is for all those relatives of the patients who are losing their loved ones. Then there is oxygen, but your loved ones are dying because logistical issues are not getting sorted out.
Right, and we
now
can
that's
also
very,
see
very distressing.
Absolutely, I can just imagine, and we can see the situation in the wards also with patients actually lying on the ground. It clearly shows that the Goa situation is in a crisis situation given your positivity rate is so high of 40%. The Goa Chief Minister has just tweeted about how they're receiving oxygen concentrators which will be transported by the Indian Air Force, but it's too late for the people who have already died, and one would have imagined that you know the logistical issues would be sorted out and more efforts would be made to ensure not one single patient dies just because of oxygen shortage.
Yeah, and what we have been told right now is that last night the entire state administration was struggling to get more number of oxygen cylinders because the High Court is going to continue the hearing today morning. So they were struggling to get more number of oxygen cylinders, and they brought some of the oxygen cylinders even from the primary health centers to show that there is enough supply in Goa Medical College. So that is the kind of jugaad that is happening because the High Court is going to hear the matter again today. So that's the situation on ground. And it's very, very distressing. It's very pathetic. People are suffering. We need solutions as soon as possible, probably yesterday. We don't even need solutions today. We needed solutions yesterday. Because even if these are logistical issues, if this is the issue of proper resource allocation, that should have happened probably a week back. If for 8 days, every night after midnight, we media persons, authorities, administration officers start receiving calls after midnight that the oxygen levels are dropping. There are videos circulating from last night where the monitors are showing clearly that the oxygen level is dropping and patients are panicking. Even doctors unanimously are posting on social media and saying that it's a very distressing time for them. They want to save lives of people, but they are not getting enough resources and the backup to save lives of people. So that's the situation on ground. So when I say that we needed solutions yesterday, we needed solutions probably 8-10 days back. This cannot continue for 8-10 days.
Given the high number of cases, you can't be reacting to a crisis. You have to be prepared and ensure you have enough beds, have enough oxygen, have enough hands on deck to ensure nobody dies, not because of COVID, but because of a lack of oxygen. Thank you so much, Pramod Acharya, for joining us. Now a report from Haryana, where youngsters between the ages of 18 to 44 are struggling to book vaccine slots. NDTV's Meher Pandey found that many were unable to book vaccine slots and that several people from urban areas were in fact booking slots in rural centres, leading to inequality in vaccine access.
We are at a community hospital being used as a vaccination centre in Sona in rural Haryana. Sandhya Nair, a 30-year-old Gurgaon city resident, has come to this centre 20 kilometers away to get the vaccine.
Registering in COVID and then getting a slot isn't an easy task. We've been trying for 4 to 5 days now, and it's only my mother-in-law who has as of date got the jab. My husband, my sister-in-law are yet to get it. We've been trying to get slots every day in the morning, 6 o'clock to 8 o'clock, 9 o'clock, we keep trying. but we hardly get any slots.
So vaccination slots in Gurgaon are very difficult to come by. As you can see, every single slot available has been booked up. The only two private centers, which is a Max hospital and a Fortis hospital, have also been booked. Max is booked up until June. So every day there is a mad rush for these slots, and it's the people with the fastest internet, the most knowledge of how OTPs work, how to use these apps, are the people who get the slot. And it's the people who are urban, who are educated, upper middle class, who get these slots. Naveen Sharma, a 28-year-old trainer from Badshahpur in Sona, is one of the unlucky ones. He has not been able to book himself a slot since the 1st of May.
हाँ, वैक्सीन लगवाना चाहते हैं, लेकिन उसमें क्या करें कि हमारा स्लॉट्स ही नहीं मिल पा रहा है हमें. जब भी इसको ओपन करते हैं तो स्लॉट्स नॉट अवेलेबल आता है, तो कहाँ से लगवाएं हम वैक्सीन.
Dr. Nutan Yadav, who runs a health center in Palra, Gurgaon, has been working to make 18 plus vaccination more accessible.
हमारे यहाँ villages के लोग अच्छी तरह से समझ रहे हैं. They have a good cooperation और वो भी उनके बच्चे जिनके educated हैं, and even we are helping them कि हमने उनको sites बताई हैं, and we are helping them कि how to do this booking and कैसे registration करना है, कैसे site. हमने कोविन portal उनको बताया है proper, उनको उनके जिनके educated बच्चे हैं और जो नहीं कर पा रहे, we are helping them out and हम slots book करने में सबकी help कर रहे हैं. But still, out of everyone we spoke to, all over 45 who had walked in for vaccination were from neighbouring villages, while most people between 18 and 44 who had booked slots on Covin were from Gurgaon city or even Delhi. We have been to 2 rural vaccination centres in Gurgaon and were told that roughly 60% of slots were taken by people from nearby urban areas. Inaccessible registration has made vaccination glaringly unequal. This is especially worrying because the virus is spreading rapidly in the rural areas. With Pooja Arya, Meher Pandey for NDTV.
Now, fuel prices are at a record high in May, and these high prices amid the economic hardships already that many people are facing. In fact, the reports that thousands of Ola and Uber drivers have lost their jobs since last September, and the repayment of EMIs is believed to be the biggest reason.
For Mohammad Riaz, an auto driver from Maharashtra's Parbhani, it is a battle for survival. First, his business took a hit due to the lockdown. The rise in fuel prices has added to his miseries as petrol prices touch 100 rupees per litre in Parbhani district.
एक साल होगा लॉकडाउन है सब क्या करना अभी ऑटो वाले सब परेशान है सब व्यापारी लोग का परेशान है ऑटो में कोई बैठ रहा नहीं.
Story is no different for Mumbai's Jayesh Sherekar, an Ola driver. Jayesh stays in Navi Mumbai and comes to Mumbai for work every day. He is now finding it difficult to save any money. He says with petrol at 85 to 90 rupees a litre, he could at least take home rupees 200 to 250 daily, depending on number of trips. But now, with business down, he hardly gets 2 to 3 trips a day. According to multiple reports, about 30,000 Ola Uber drivers lost their jobs since last September, and repayment of EMIs is believed to be the biggest reason why many could not sustain the job.
4 घंटे में अगर मैंने 150 रुपये कमाया उसमें 100 रुपये मेरा फ्यूल में चला गया, मेहनत चला गया और एसी लगाएंगे उसमें कस्टमर को एसी लगता है तो एसी के वजह से अभी क्लाइमेट का हिसाब से फ्यूल और ज़्यादा लगता है.
Kiran Alekar was in tour and travels business. But since that is shut, he has now moved into business of helping people with their documentation. For that, he uses his bike daily. Kiran says a business that was at 80% has now come down to 30%. And this fuel price hike will put an extra burden of at least 1500 rupees per month in his pocket.
मैं अगर थाना से मुंबई ट्रैवल करता हूँ फॉर माई वर्क, पर्सनल वर्क, फॉर माई ऑफिशियल वर्क, तो आई कैन नॉट बी डिपेंडेंट ऑन द ट्रेन्स एंड बस. आई हैव टू ट्रैवल ऑन बाइक. पर अचानक 3 दिन में इतना राइज होने की वजह से हमको अभी ये सोचना पड़ रहा है कि अभी ट्रैवल इससे करें या बस या ट्रेन से करें.
For the third consecutive day, petrol and diesel prices were hiked. This is the 7th increase since May 4th after the elections. In Delhi, petrol is at 92 rupees and 5 paise, while diesel is at 82 rupees 61 paise per litre. In Mumbai, petrol per litre is at 98 rupees 36 paise and diesel is at 89 rupees 75 paise. In Chennai, petrol is at 93 rupees 84 paise per litre, while diesel is at 87 rupees 49 paise per litre. And in Kolkata, petrol is at 92 rupees and 16 paise per litre, while diesel is at 85 rupees and 45 paise per litre.
According to a recent report by Azim Premji University, around 230 million people lost their jobs in this pandemic. And with increased fuel prices, it's becoming difficult for people to survive this lockdown where they have no option but to use their own vehicles. With Kanhaiya in Parbhani and Pravinji Rohit in Mumbai, this is Purva Chitnis for NDTV.
Well, time for us to slip into another break, and on the other side we'll get you international news, and the big news we'll get to the latest on the Israel-Palestine conflict, where violence has escalated with rockets being fired. Hello and welcome. You're watching Good Morning India. I'm Gargi Rawat. Our top story: the Prime Minister chaired a review meeting yesterday evening on availability and supply of oxygen and medicines to battle the COVID pandemic. During the meeting, it was also discussed that the supply of oxygen is now more than 3 times the supply during the peak of the first wave. And the Prime Minister's office also said that the Prime Minister remarked that states should be asked to operationalize ventilators in a time-bound manner and resolve technical and training issues with the help of manufacturers. Let's go across to Sunil Prabhu now for more on this story. And Sunil, tell us more about what happened during this review meeting. Oxygen, medicines discussed. Also this issue that has emerged from various states of ventilators not functioning properly or not having the manpower to function them.
That's right. And I think I'll take the last point, of course, about the fact that the Prime Minister himself pointing out that states need to work with manufacturers and operationalize these ventilators and make sure that they are working condition, because there are patients who are gasping for breath, and it's really criminal to see them not being used optimally. And it's in that regard that the Prime Minister remarked that they need to be definitely streamlined and ensured that the manufacturers and the states work with them and get this working. Having said that, of course, the oxygen, as you rightly pointed out, is saying that it's at 3 times the above level than it was during the peak of the first wave. So some corrective measures have been taken after we saw those export of oxygen and the preparedness not really at its optimum, when people were gasping, and we saw lots of loss of lives across this country in various hospitals, patients who were gasping for breath because they couldn't get oxygen. Having said that, there are, of course, issues in terms of the fact that the minister did explain to him in terms of life-saving drugs, the remdesivir and other life-saving drugs which are required, that they're working with manufacturers to see how they can step up. But the most important point, Gargi, is that they were silent about the issue of vaccines. And I think somewhere down the line, everybody understands that if India has to succeed through the second wave or the third wave, or whichever wave that comes, we all need to get vaccinated, and that needs to be showed up. State after state are doing global tenders, but we haven't been able to address this important issue of vaccination, where there is a shortfall and there is a skewed terms in terms of where all it has to be given. Because if, as you are well aware, if India has to succeed, everybody, not only you, me, but even those who don't have access to mobile phones, they need to be given that facility if India needs to succeed in fight this battle against COVID.
All right, Sunil. So the important and vital issue of vaccines not being discussed during that review meeting that the Prime Minister held. And you're absolutely right. Each state for itself now struggling to get vaccines for themselves, even floating global tenders. Now, after bodies floating in the Ganga in Bihar and bodies allegedly from UP, now fresh reports have emerged of multiple bodies found buried in sand at 2 locations in Uttar Pradesh's Unused district, just 40 kilometers from state capital Lucknow. Visuals from both locations showed many buried bodies, with locals looking on. Most of the bodies were wrapped in a saffron cloth. It's not clear, however, these bodies are of COVID victims. Locals, though, believe the shortage of wood for funeral pyres might be one of the reasons why corpses are being abandoned in this manner.
देखिए, अभी बक्सर जो घाट है वहाँ पर कुछ डेड बॉडीज खुले होने की जानकारी प्रकाश में आई थी, बक्सर घाट एक ऐसी जगह है जहां 3 जिलों का बॉर्डर है, फतेहपुर, रायबरेली और उन्नाव। वहां 3 जनपदों के लोगों की मृत्यु होने पर वहां लोग शव जलाने आते हैं। कुछ लोग ऐसे हैं जो शव को गंगा किनारे रेत के नीचे दबा भी देते हैं। तो ये जानकारी मिलने पर मैंने तुरंत अपने एसडीएम को और पुलिस क्षेत्राधिकारी को भेजा है, और अभी तक उन लोगों ने जितना देखा है किनारे की तरफ तो इस तरह की खुले में बॉडी नहीं आई है, लेकिन अन्य जगह भी मैंने जांच करने के लिए कहा है, और जो भी स्थिति आएगी इसमें उचित कार्रवाई की जाएगी।
सर ये बताइए, जैसे कि कुछ चीज़ें सामने आ रही हैं कि जो गांव ग्रामीण इलाका है वहाँ पर जो लाशें हैं वो कोरोना की लाशें हैं, कोरोना से खत्म हुए लोगों की लाशें हैं जिनको ट्रेस नहीं किया गया, तो ऐसा कुछ वाकया क्या सामने आया?
नहीं, ऐसा तो कुछ नहीं है, और ऐसी कोई जानकारी भी नहीं है कि वो
शव कुछ पहले के दबे हुए बताए जाते हैं, गाड़ी गए बताए जाते हैं।
देखिए, वो शव ऐसे ही देख के अभी कुछ इसमें नहीं कहा जा सकता है। वो पूरी टीम गई है, और जो भी इसमें उचित होगा हम लोग उसमें कार्रवाई करेंगे।
Well, let's go across to Alok Pandey now for more on this story. And Alok, it's an absolutely ghastly sight to see so many bodies there just buried in the sand. The authorities saying right now they cannot say whether these are indeed COVID victims.
Well, yes, that's what they're saying, Gaki. But I think the larger context to the story, of course, is the fact that there is a big worry that the pandemic this time around has now spread to UP's rural areas. And as you and I and everyone else is aware that UP has a vast amount of rural areas across the length and breadth of the state. And while the government is saying that they are trying to adopt a policy of track and treat, where they are sending these teams into villages to test any symptomatic cases and to ensure that they are treated, you at the other hand have these kind of visuals coming in not only from Unnao, may I remind everyone, but also say from Balia, which is in eastern Uttar Pradesh, around 300 kilometers I think from where Unnao is. Where also bodies were found floating on the Ganga, and this here in Unnao is a case where you see those visuals. They really are ghastly, of all of these bodies buried in the sand and silt by the river. And while officially so far no reason has been ascribed as to why this has been done, one interesting thing that the DM was saying was that one of the locations where the bodies have been found buried is a cremation ground where bodies from 3 districts are brought generally to cremate them. And unofficially, there is some news that, many of the people who are coming right now simply cannot afford even firewood, because that firewood is sold there and they cannot afford it, and that is why perhaps they are burying the bodies in the ground and leaving. All in all, it's just distressing to see this, and I think what the administration may do now is to carry out an inquiry and try and see if these bodies can be cremated, because it's you cannot just leave them lying buried like this and exposed, and that again will lead to even more health complications if nothing else. So I think it's a very grim picture in Uttar Pradesh right now.
Right. Alok, thanks so much for joining us with those details. Well, news now from Karnataka, and let's focus on the vaccine drive. And after Karnataka had announced that vaccinations for the age group of 18 to 44 would open, now it's temporarily been suspended in all government vaccination centres from the 14th. Let's go across to Maya for more on this. So Maya, shortage of vaccine doses and the state wanting to concentrate on those above 45 years.
Karnataka Chief Minister B.S. Yediyurappa actually symbolically launched the 18 to 44 vaccines on May the 1st, despite earlier confusion saying it would be postponed. But it was launched. Some people have got that vaccine, but now the state government saying that there just isn't enough vaccine to go around, and that from tomorrow, May the 14th, 18 to 44 group vaccinations are indefinitely postponed. They just don't have enough vaccines, and they're going to be focusing on getting to the second dose to those who have taken their first injection. So the second dose is the focus. 18 to 44 will have to wait. Even those, it must be said, who have already registered on the site and have slots booked from the 14th onwards. The hope, of course, is that vaccines will arrive, and soon. The state government has placed an order for 3 crores of vaccines from the Indian manufacturers, and has also floated a global tender for another 2 crore vaccines. Deputy Chief Minister saying that they're trying to get vaccines really from wherever they can as soon as they can. But for now, it's very clear that there are not enough vaccinations in hand for everybody, and that the focus is going to be on the second vaccination. So much is the desperation really that we're also finding people from Bengaluru perhaps who are more tech savvy, booking slots in villages around the city as well and going there to get their vaccination slots. This is something the state government will actually be looking into. So not enough vaccinations in Karnataka. 18 to 44, that age group will have to wait for a while. Some private hospitals, though, are acquiring the vaccine directly and are still administering shots. But at the state government centres, 18 to 44-year-old age group has been temporarily suspended from tomorrow.
All right, Ma, even after a symbolic sort of launching of that vaccination drive for the age group. Thanks so much for joining us with those details. Well, to talk more about the COVID situation in the country and COVID management and the lockdowns and vaccinations, we're now joined by doctors. Dr. Preeti Sharma, pulmonologist, Grecian Hospital, Mohali from Punjab. Dr. P. Manokar, Professor, Department of Cardiology, Sri Ramachandra Medical College and Hospital. And also Dr. Dodul Mandal, Senior Oncologist, Apollo Hospital in Delhi. Thank you so much, doctors, for taking time out and joining us. First to you, Dr. Preeti Sharma, the worry now is rural parts of the country and especially in Punjab, one gets reports of how people are absolutely reluctant to go ahead and get tested, even to get vaccinated. And this is a huge challenge as many are infected and there's so many deaths being reported as well.
Yeah, we have a lot of problem. We have been telling people that come on, turn up and get yourself tested, which is very, very important. If we do it at the time, within the frame, then we can always prevent the further manifestations of the disease. See, if we are just reluctant, people are so reluctant that we don't have fever, we don't have a kind of COVID fever, it is just a normal fever. It's a really pathetic situation, although being telling everything on the radio, on television, on everywhere, just a fever and cough, we no need to ignore these kind of things. We have to have more campaigning for this, for the villagers, for the people who are not educated actually. So we need to have it so that they come on and they get themselves tested. And then the only thing is the symptoms have been published in every kind of news. But still, they are not able to tell us this.
Right, absolutely. And that is the big worry. Dr. Mandal, even though in Delhi the situation somewhat seems to be, settling, there's less, it seems a less franticness for getting beds and oxygen, etc. But even so, we do know that as far as the lockdown it goes, there's no chance of us, easing the lockdown just yet because we're just about getting control of the situation.
Yeah, I fully agree with that. The initial crying about scarcity of bed and oxygen, that has definitely gone down. And we have been also seeing a significant dip in number of cases over the last few days. That's definitely very much assuring. At the same time, definitely lockdown has helped. Almost 3 weeks now we are into lockdown, and that has definitely helped spreading the infection. So it's prudent that we continue this measure so that the absolute number of cases are going down. And at the same time, ramping up facilities for oxygen, beds, we maintain and sustain these things.
Right. Dr. Mandal, another issue that is being spoken about by a lot of doctors is, over-medication or the overuse of steroids. And what many have been pointing out is sometimes in the treatment of COVID patients, steroids are being introduced too soon, and that is actually complicating the situation. If you could just tell us more about that.
Yeah, that is a reality, and there are a lot of factors into that. Many people are actually Googling their symptoms and they are starting their treatment without even consulting a physician, forget about consulting a pulmonologist. That's definitely not right. They have to have some kind of guidance from some physician who are at least aware about health problems. Nowadays, we are definitely considering all fevers to be because of COVID until or unless being proven otherwise. But that does not mean that there will not be other illness also. So our physician will definitely be in a much better condition to understand and guide whether this can be because of COVID or something else. These will help in two ways. One, diagnosing COVID, and also diagnosing other patients who are not having COVID and providing them treatment in line of that. Now, coming to the using of steroids, two medications are now actually being put forward in a big way to save patient. One is steroid and the other one is blood thinner. Both are definitely important. The timing and sequence is perhaps most crucial. And there comes the role of a doctor, where patients are actually failing. Many people are starting from it day one. Many of the patients who are mildly symptomatic may not require any medication, but they're all getting the side effects of steroids and complications. Perhaps you are aware of this new coming side effects of mucormycosis. So many people who are diabetic, they are immunocompromised, they are taking steroids unnecessarily. So definitely that's not a good thing. So steroid is definitely important. Blood thinner is important. Knowing when to start, at what dose, when to reduce the dose, when to stop the treatment, those are definitely very much important. And that comes from a specialist.
Right, and this worries over mucormycosis, we'll talk about more the black fungus infection that is being talked about. Dr. Manokar, in Tamil Nadu also the cases are just too high for comfort, nearly 30,000 cases still being reported. Tell us more about this test being taken. There are people in rural parts able to access testing, because this is a problem we're seeing in several states. In rural areas, people are getting what they describe as mysterious illnesses, or they're being told they have typhoid, whereas actually in most cases it's COVID.
Yes, truly in Tamil Nadu also the situation is alarming, simply because the cases have been rising. But one good thing is, from day one, Tamil Nadu has always been insisting to do RT-PCR for COVID diagnosis, and unlike other states which used to rely on antigen testing. So even now RT-PCR is the gold standard for testing in COVID, and that's what is being done in Tamil Nadu. Definitely the oxygen situation is a big challenge, and transportation, everything, ambulances with oxygen facilities, periphery hospitals are running out of oxygen. So definitely the oxygen situation is probably the most precarious thing at present. Remdesivir is more easily available after the government took initiative, but still I personally feel it has been abused drug, it has been overused, and many people who do not need have been given, and there is a big black marketing and hoarding happening. And that is a very sad truth in this hour of crisis. So as far as Tamil Nadu is concerned, the biggest challenge is to keep people who can be managed at home, and make sure that people who need to be in hospital are in hospital and they get a bed. So it's more of a social challenge, ensuring that people who can be very well managed by home quarantine should be managed at home, and it needs a lot of effort from everybody, from the medical fraternity to media to everybody, to ensure that people who do not require to be hospital do not end up occupying very crucial hospital beds, which are the biggest demand for today.
Right, Dr. Manokar, because a lot of, there's a worry in the kind of scenes that you're seeing, getting access to hospital beds. At what point does a person, look for that hospital bed? That is another thing that is confusing many people, monitoring the oxygen, and at what point do you escalate the situation and realize that you need to rush to a hospital?
That is true. In fact, sometimes I feel as a nation, our morality is under question. I hear stories of people blocking hospital beds, ready to pay for the beds even though there are no patients, to ensure that it is needed for them when it's available. These are morally unacceptable things, but that is happening on a rampant scale. People are so in panic mode, they end up hoarding oxygen cylinders, people hoard up remdesivir. People call me that they have already got hold of oxygen cylinder, they have got hold of remdesivir, and they also have a dose of tocilizumab, and then ask me, should I do an RT-PCR or wait? So that's the level of panic and hoarding that we are seeing day to day. It's painful, but it is true.
Right, and mismanagement, but for this, of course, it's the public to blame. Thank you so much, doctors, for joining us and talking about, the management of COVID right now, and currently the problems being faced in different parts of the country. Thank you.
You're welcome. Thanks.
With that, time for us to slip into a short break. More news on the other side. Stay with us. News now from West Bengal, where Chief Minister Mamata Banerjee and Governor Jagdeep Dhankar have once again locked horns, and this is over his plans to visit Cooch Behar district to meet, as he puts it in several tweets, people affected by the post-poll violence. In fact, Mr. Dhankar is on his way to visit Cooch Behar. There you can see visuals from inside the aircraft. He flew from Kolkata in a BSF aircraft. In fact, on Friday, he even plans to visit camps in Assam where alleged victims of the violence in Bengal have fled for shelter. Mr. Dhankar had announced his travel plans on Twitter, and Ms. Banerjee had then written to him requesting him to not to break well-established norms and go off on a unilateral visit across the state. The governor had then responded with his own letter. Let's go across to Moni Deepa now for more. And Moni, there was this back and forth from Twitter to letters between the Chief Minister and the governor. Now he is on his way to Cooch Behar.
That's right. We are being given to understand that he has taken not a state government helicopter but a BSF aircraft, and he's headed out to Cooch Behar, where instead of 11 o'clock we are being told he will land at noon. That's his first day visit. He has also announced on Twitter that he will meet the media at the Circuit House later in the day. Tomorrow he will go to Assam to apparently see these shelter camps for alleged post-poll violence victims who have allegedly fled to Assam for shelter. So this is his plan, but it has completely upset the West Bengal government. Mamata Banerjee requested him in a fairly strongly worded but extremely polite letter yesterday, saying that he should not be violating existing norms, because this would completely violate the norm that the state government has to concur with the governor when he makes travel plans. But the governor is apparently still going ahead with his plans. Analysts say this is a little unprecedented, and the governor is violating norms that are well established and long laid. How this will ultimately sort of play out is something we'll have to watch and see. But the governor is going to go to 4 places in Cooch Behar, including, if you recall, Chital Kuchi, the hugely sensitive zone where, if you again recall, 4 people had been killed in Central Security Forces firing on poll day on the 10th of April. And remember, at that time, Election Commission had said Mamata Banerjee cannot go. She had gone later, but the governor is going to be there a few hours from now, and we'll have to see how this plays out.
All right. Thanks so much, Moni, for joining us. So the governor going to reach there at around noon. And finally, Telangana is under a 10-day lockdown, and a 4-hour relaxation has been given for the morning between 6 a.m. and 10 a.m. and everyone's rushing to stock up on essentials. But just a day away from Eid, and take a look at the visuals from near Charminar, where people are shopping on the eve of the festival, barring vehicle movement. Later has meant huge traffic jam in old city areas, and you can see the massive crowds that are shopping in that area. Now, even for the festival, Hyderabad MP Asaduddin Owaisi has asked that people pray at home, not step out. But just a day before Eid, crowds there in the market for shopping. There you can see just how massive crowds have gathered. No sort of social distancing, no COVID protocols being followed at all. Well, with that, time for us to slip into a short break. More news updates on the other side. Stay with us.